Let me get this going. Alrighty, Matt. So let's just jump into it. Phase two has been announced to start on Monday. Kind of tell me the progress we've made with vaccines.
Sure. Well, as you probably know, and your viewers probably know, New Mexico continues to lead the country. In fact, we're pulling ahead of our closest rivals in terms of the speed of vaccine distribution here. And obviously, it's not a competition, hoping that every state moves really fast, but we're happy with our progress, broadly speaking. Nearly half of New Mexicans have now gotten at least a first shot. And part of what that means is in a state as diverse geographically and in every other way as ours, there are communities, especially in the rural areas, that just can't find folks to vaccinate anymore in the current categories. So that's part of the reason for moving ahead to phase two. Another part of the reason is because we know that young people are currently registered at slightly lower rates than other groups, and we really want to encourage them to register as quickly as they can. We're getting increased allocations from the federal government, and we want to put them to use. We want to get them into arms as quick as we can. We know that to get to herd immunity, we need to have participation from every sector of the population, including young people. And I think we've been looking at this a little bit. We're going to learn more, but we think that young people, in some cases, are feeling like COVID just doesn't affect them quite as much as it does older groups. And we really want to be clear that, one, it does absolutely affect young people, often in troublingly serious ways with long-term consequences. But also, this isn't just about us as individuals. This is about us getting vaccinated so that we protect our family members, our elders, our grandparents, and so that we can all get back to doing the things that we miss, going to our sibling soccer games and getting together for family meals and big events at our churches and other religious organizations. So this is an all-in, all-hands-on-deck kind of thing, and we're hoping that young people will register quickly.
So for those who are, say, 16 to 18 that are eligible for the vaccine, they'll have to rely could have to rely on their parents signing them up and things like that. What do you have? Are you going to be partnering with some schools and with the public education department and to kind of get that out there for the high schools? Like, hey, some of your students are eligible. Start registering them.
Yeah, we have an outreach team out of our larger vaccine distribution effort that's in conversation with PED, with HED for our college students. And then we're talking to folks in Albuquerque, the city government, and among racial and ethnic groups across the state, municipal governments. We put out a solicitation maybe about a week ago saying, hey, we're really looking to ramp up outreach efforts to young people. And we got a flood of really lovely feedback and offers to participate from city governments across the state and elsewhere. So we know that there's an interest in getting that message out, and we're going to make sure it happens.
Now, in some more rural parts of the state, there are, solely school-based health clinics. Are there kind of plans to try to bring vaccines to some of those school-based health clinics for students who, like high school students, younger students, 16 to 18, whose parents may want them to receive the vaccine but can't easily get to a vaccine site?
It's a good question. I'd have to check with our operations people about exactly how those invitations are working. As you say, and one of the parallels here it's worth talking about is, for the past month, about a month ago, we announced that according to the president's directive, it was our job to vaccinate educators in New Mexico, and we were going to try to do it in about 3 weeks. And we've basically done that. We've gotten vaccinations to a huge portion of the early childhood professional staff, the K-12 staff, the school staff. And so we have this nice experience now to build on about how to distribute vaccine to education-related populations. As you say, sometimes that takes place in school settings. Sometimes that just means sending an invitation so that somebody goes to the local clinic where there's a shot available, or the pharmacy or wherever. So I think it'll take different shapes and forms in different parts of the state, but we now have this nice base of experience to build on in terms of distribution.
Now, with this announcement, there may be some who are, 75 or older who may have not received a vaccine yet. The Department of Health has opened it up where you don't have to have an event code for 75 and older. Kind of what do you have to tell these folks? Just like go and get your shot. You don't have to go through any extra hoops for those. And are you prioritizing some of the other phase categories as well still with the opening of phase two?
So we're always prioritizing the order of the phases. Thank you for the reminder and the question. Yes, so even though phase 2 will be open beginning Monday, we're still prioritizing invitations to the earlier phases. So if you're phase 1A and you somehow haven't gotten an invitation at this point, we're prioritizing you, 75 plus, 60 plus with chronic conditions. I do want to say that within our registration system, we've reached out to 99.9% of people 75 years and older. However, sometimes that communication breaks down. Sometimes it's on our end, sometimes it's on their end. Maybe they supplied the wrong email address or something, and so the communication doesn't get through. But by and large, we've reached out to those folks at almost 100%. In fact, some of them many, many times. But we recognize that seniors and others sometimes need other forms of support to get registered or to receive that invitation. And so we have lots of other ways of reaching out to seniors through the call centers, from UNM and from the Aging Resource Center. And then a whole range of other supports, including ramped up efforts around homebound vaccinations, efforts through senior centers that are doing 5,000 vaccinations a week. So lots of ways to get to that senior population. And that'll continue to happen until every person who wants a vaccination gets one.
And again, in phase 2, it's a lot of the younger generation, 16 to 25, or those who, don't have chronic conditions that are just kind of there. And the big push to, I guess, take away from this is trying to get the younger folks to register. And I know some of them were discouraged, like, oh, phase 2 is so far away, I may just not even register. But that's not the case.
Exactly right. So if I can just take us back a couple of months, when we rolled out our phase distribution plan, we projected mid-summer, even late summer, to get to some of our general population, our phase 2 population. That was including me. And we got there months faster than we thought we could, in part thanks to the hard work of New Mexicans and healthcare providers and volunteers, in part thanks to the enthusiasm of New Mexicans for vaccine, in part thanks to the federal government for sending us increased allocations. But we're there. We're there, months faster than we thought we would. There's nothing to wait for any longer, and more supply is coming. So by all means, get yourself registered, and we'll get you an invitation as soon as we possibly can.
Awesome. Anything else, Matt, you can think of?
Yeah, a couple other things, or at least one, which is, we understand that there are different questions that folks still have about vaccine, totally legitimate, happy to have those conversations. One place folks can look for resources is vaccinenm.org/facts. We've addressed many of the most common concerns or questions folks have about vaccine, including some of the rumors. We've also assembled a range of what we're calling trusted voices. So videos, testimonials from folks, pastors and young people and educators and doctors and from all across the state, talking about their own experiences getting vaccinated, questions they may have had, then how the experience went, then any side effects they may have had, just so folks can, folks don't need to be listening to DOH first and foremost all the time. Much better for them to hear from local folks in their town, in their community that look like them, that are participating in their religious groups, whatever it may be. It always works better for folks to hear from folks they know and trust. And so we want to make sure there are as many voices participating in that effort as we can possibly gather. And that's all available at vaccinenm.org/facts.
Awesome. And always keep wearing masks.
Absolutely. I'm here at home, but all your COVID safe practices still apply: masks, social distancing, and the like. And one last thing I do want to say, actually, if I may, is, we a couple of weeks ago rolled out our vaccine equity plan, and we've been doing quite a lot more in that area. So I'd be remiss not to address it just quickly. One of the things to say here is we recognize that registration and vaccination rates are not equal to this point around across every racial and ethnic group, and we want to make it such that they are. We want to help every group register as quickly as they possibly can and get vaccinated as quickly as they possibly can. And that's part of a larger learning, I think, that's come out of this pandemic. Dr. Collins, our DOH health secretary, makes this point all the time, which is, we knew even before COVID that there were health inequities across the country and especially here in New Mexico across racial groups in terms of access to doctors and care and well-being more generally. And obviously the pandemic has exposed that and made those disparities even more vivid. And so what we're trying to do is begin to address them, in part because we can see them so much more clearly now. This gives us an opportunity to address them in a meaningful way. Part of what we're doing in the short term is the equity plan, which is designed to get vaccine, to pull some vaccine doses right off the top of our allocation and send them to communities that are most vulnerable But part of what it means over the longer term is thinking about our systems and building health systems that address all the social determinants of health and ensure that every New Mexican has an equal shot at health and well-being.
Awesome. I think that's all I've got, Matt.
Okay.